Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, March the 22nd, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen Davila. Mayor Tory?
Well, thank you, Brad, and good afternoon. The City is continuing to work to get shots in arms, along with Toronto's hospitals, with our healthcare partners, and with pharmacies. This work is based entirely on vaccine supply, but more and more supply is on the way from the Government of Canada, so a continuation of our ramping up should be a reality. To date, 374,631 COVID-19 vaccine doses have been administered to people in Toronto, and with today's uptick in activity, which we'll hear about from the Chief, the numbers I'm sure even higher than that already. Along with our 3 city-run clinics, which are stepping up the number of doses administered as of today, our hospital and healthcare partners, between us all, we're running 17 clinics today, many of which are also vaccinating 80-plus seniors. Chief Pegg will detail today how thousands of people have been registering in the last few hours to make appointments at the city-run clinics now that people 75 years of age and older are eligible to be vaccinated. I continue to urge people to get vaccinated when they are eligible. The provincial priority list was always set on the basis of relative risk, and as a result it continues to be very desirable for those in the original 80 years of age and older group to get vaccinated as soon as they can. The sooner we are all vaccinated, the sooner we can bring this pandemic to an end. So when you become eligible, please take steps to register and to get vaccinated. I'm proud to announce a major step forward in our vaccination efforts is underway in Thorncliffe Park. The City is partnering with East Toronto Health Partners, including the Michael Garron Hospital, to open a mass immunization site at the East York Town Centre. This would be the City's 10th mass immunization site on top of the 9 City-operated clinics. I want to thank the East Toronto Health Partners for leading in the effort to establish this clinic in Thorncliffe Park. The site is already vaccinating more than 200 people today who are 80 years of age or older. It will officially open Wednesday with capacity to vaccinate more than 1,000 people. And as supply availability increases and more staff are hired, the site will ultimately be able to vaccinate 10,000 people each and every day. This is another in the series of initiatives undertaken by health partners in the east end of the city, an area which includes several communities where this extra local support and attention will produce a better outcome for them and for all of us. We also heard on our immunization task force call this morning that this clinic will also be looking at the possibility of running on an extended hours basis in the coming weeks. This is a true example of the Team Toronto effort underway to get as many people vaccinated in our city as soon as possible, and to do that on a basis that makes it accessible for them. We are doing everything we can to get as many shots in arms as possible, as soon as possible, supply permitting. I want to thank everyone involved in getting this clinic up and running, including local councillor Jay Robinson, who's been working on this for a number of weeks and has been extremely supportive of this effort. I know she's been working day and night since the idea was first proposed by East Toronto Health Partners to make this site a reality for residents in the Thorncliffe area. Our work to get seniors vaccinated is also going full speed ahead, and we are working on innovative ways to make sure that we are reaching them. The Toronto Public Library is mobilizing its staff to reach out to seniors to make sure they are aware of how to register and to provide further information if needed. I want to thank City Librarian Vickery Bowles for working with the City staff to start these calls this week. Library staff will start with calls to about 10,000 library users who are seniors, 80 years of age and older, and then reach out to about 25,000 more seniors between the ages of 70 and 79. Toronto Community Housing is also working to help seniors in their buildings get vaccinated. TCHC's 83 seniors buildings have partnered with hospitals, and we are working on vaccination plans to help people in these buildings get vaccinated. As of Friday, the Toronto Community Housing Corporation has held vaccination clinics in 23 seniors housing unit buildings, with 5 more planned for this week. Of the 23 seniors buildings where we have done door-to-door vaccines, about 70% of the tenants have accepted the vaccine, and that is a great start. In that case, I want to thank the Toronto Community Housing CEO, Kevin Marshman, and his team for all of their efforts, along with this ongoing outreach with the support of the city to individual seniors who are TCHC residents who don't happen to live in one of the seniors' buildings. Toronto Community Housing continues to work with Toronto Public Health and health partners to bring access to community testing and vaccinations closer to its family communities. To date, more than 43 community testing clinics have been taking place in the family portfolio of TCHC, with 5 vaccination clinics planned in the coming days. City staff have reached out to 40 senior-serving organizations and offered financial support to increase staffing and redeploy staff to reach out to their clients, senior clients, to support them to set vaccine appointments in the coming weeks. The city has offered these agencies up to $10,000 each to ramp up their efforts to help seniors get registered and get vaccinated between now and the end of April 2021. The agencies were selected to ensure that we continue to focus on target population outreach, including the Indigenous communities, the Black communities, the South Asian communities, and other population groups, including Hispanic, Tamil, Korean, and LGBTQ2S seniors. The city is also working with the Red Cross to place senior-specific posters in food hampers and engaging as well with synagogues, churches, and temples to bring information to their senior communities. Finally, I wanted to offer an update on the pharmacy vaccine rollout. More than 200 pharmacies in the City of Toronto are offering the AstraZeneca vaccine right now, and we expect that number to grow as the Government of Ontario expands the pharmacy vaccine program. Toronto is one of 3 regions participating in this pilot at present, and we know that this will help to speed the vaccine rollout overall. We want to ensure that pharmacies in the areas of the city that have been hardest hit by COVID-19 have the vaccine to offer residents specifically in these neighborhoods. Toronto Public Health has looked at the current map of participating pharmacies and has provided additional locations to the Ontario government where the program could best be expanded in different areas of the city, based on public health advice, particularly in Toronto's northwest and northeast areas. We have experience across the city, including in these areas, as a result of initiatives like our annual flu shot campaign, and we have made the list of these additional locations available to the province to ensure effective and equitable coverage in some of the areas hardest hit by COVID-19. So these are just some of the efforts underway to get people vaccinated. I wanted to highlight them today, in particular, to show how far we have come in a difficult year, and to pay tribute in particular to the entire team led by Chief Pegg and Dr. Davila and all the people working with them from across the spectrum to make all of these different things happen. It was a year ago tomorrow that I declared an emergency in Toronto in the wake of the growing COVID-19 pandemic, the first time such an emergency had ever been declared in the history of our city. Now, a year later, our focus is on vaccinations to stop the virus and to bring the pandemic to an end. We are so close. We're closer than we've ever been before, notwithstanding numbers that you'll hear about today that are still of great concern, but we are closer than we've ever been before to that welcome day. As I said at last night's memorial for the more than 2,750 people that have died from this virus in the City of Toronto alone, we just need to soldier on and get through this crucial period that we're in right now. And that includes taking advantage of all of these opportunities to get vaccinated, but it also includes continuing to follow public health advice and continuing to encourage others to do so. It will help us to get through this nightmare and get out on the other side successfully. I would now like to ask Chief Pegg to give an update on our overall vaccination efforts.
Thank you, Mayor Tory. Good afternoon. Today is a very important day in our continuing mass immunization clinic evolution. At 11 o'clock this morning, our first 3 clinics commenced operations at more than 3 times the daily capacity as compared to last week's initial operations. Our clinic locations inside the Metro Toronto Convention Centre, Scarborough Town Centre, and the Toronto Congress Centre are now operating with twice the number of immunization stations in each clinic. Beginning this week, we are also increasing the pace of operations in each of these clinics. Both of these significant operational changes are being implemented in order to administer the maximum number of vaccine doses as possible each day. We will carefully evaluate the effectiveness of these changes over the course of the week, including the impacts to clinic throughput, wait times, and check-in line lengths. I am aware that some of the lines today have been long. Our teams are connected on this, and we are looking into a number of options to address these concerns. We will continue to monitor and do our very best to manage this in live time, and we thank everyone for their continued patience and support. Over the course of last week and continuing today, we are finding that a number of clients are arriving well in advance of their scheduled appointment time. In order to assist us in preventing excessive lineups, I ask those with confirmed appointments not to arrive at the clinic location until shortly before your scheduled appointment time, if at all possible. Also, I would recommend that people limit the number of support people that they bring with them to the clinic by bringing only those necessary to assist them in moving through the clinic. Finally, I encourage anyone who requires a mobility device, such as a walker or a wheelchair, to bring their device with them to their vaccine appointment, wherever possible. We do have some mobility devices on site, along with trained healthcare professionals and emergency first responders on site, who are helping anyone who requires assistance in moving through the clinic process. Over the course of clinic operations last week, we experienced a small number of missed appointments each day. When this occurs, our clinic managers adjust the daily vaccine order to ensure that doses are not wasted. We also reallocate unused doses to our hospital partners in order to ensure that all available vaccine doses are administered. Enabled through the provision of additional vaccine beginning today, we are now able to administer up to 4,320 vaccines each day in the city-operated clinics alone. As of 8 o'clock this morning, the provincial online and telephone-based booking systems were updated to enable those 75 years of age and older to book their COVID-19 vaccine appointments. As of 11:30 this morning, 11,726 additional people had successfully booked their COVID-19 vaccination appointments in city-operated clinics. On March 29, our city-operated clinic capacity increases again to 6,300 vaccinations per day, with both Malvern Community Centre and Mitchell Field coming online. As of April 5, this increases to 8,100 vaccinations per day, with clinic operations in the hangar in Downsview Park coming online. And finally, after April 12th, our planned capacity will increase to more than 18,000 doses per day, with our final 3 city-operated mass immunization clinics in North Toronto Memorial Community Centre, Carmine Stefano Community Centre, and Cloverdale Mall all coming online. This, of course, is all dependent on the continued availability of vaccine. As Mayor Tory announced, we are thrilled to be working alongside the East Toronto Health Partners in the launch of the partnership-based mass immunization clinic in the Thorncliffe Park Community Hub. This mass immunization clinic will provide much welcomed additional clinic capacity and will enable us to collectively evaluate a different clinic operating model. This clinic has been designed and will be operated by our East Toronto Health Partners in a format whereby clients remain in one place with the various aspects of the immunization clinic process coming to them. Further, we are very pleased to be working with our East Toronto Health Partners to evaluate the effectiveness of extended clinic operating hours in this location. I offer my thanks to the East Toronto Health Partners for their leadership, partnership, and collaboration as we work together to maximize the administration of vaccines across Toronto. In closing, I remind everyone that vaccinations are only available by appointment and are not available on a walk-in basis. I strongly encourage everyone who was born in 1946 or earlier to make your appointment for vaccination now. If you have an Ontario Photo Health Card, you can book using the online registration system, which can be accessed 24 hours per day via toronto.ca/COVID-19. If you prefer to book by phone, the provincial call centre can be accessed by calling 1-888-999-6488. The provincial call centre is available from 8 a.m. through 8 p.m. 7 days per week. Please do not contact 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the COVAX system on your behalf. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in our city. Thank you. I will now invite Dr. Davila to provide her update today.
Thank you, Chief Pegg, and good afternoon. Today, I am reporting 509 new cases of COVID-19. 258 people are in hospital following 12 new admissions. 51 people are in the ICU. I'm grateful that today I have no new deaths to report to you. The current number of cases screened positive for variants of concern is 5,428. When I reported to you last Wednesday, this figure was 3,920. Since last Thursday, we've seen almost 2,800 additional cases of COVID-19. Toronto's current 7-day moving average is 450 cases, up from 420 cases last week. Our effective reproduction number is 1.1, which means our outbreak is growing. Our percent positivity, the percentage of all COVID-19 tests performed that are actually positive, is 5%. Last week, this figure was 4.3%. 50% of all COVID-19 cases are now variants of concern, up from 44% a week ago. Our data, while sobering, is moderate compared to what is happening as a result of sharply rising cases elsewhere in the world. As I read the news coverage over the weekend, it was common to see descriptions like skyrocketing and characterizations like in the grip of a third wave. Reports from Hungary cite record high daily cases and record deaths. The only retail permitted in Hungary at present are stores selling food, pharmacies, and gas stations. France has just imposed a new month-long lockdown on Paris and other parts of the north. COVID-19 variants now represent 75% of cases in Paris. Poland is in lockdown for 3 weeks. The variants there are reported to account for 60% of infections. Germany is considering the extension of lockdown provisions for an additional 4 weeks. The head of Germany's Infectious Disease Institute said that cases are growing at an exponential rate. I am emphasizing data and developments today that should make us all think twice, to temper expectations about changes to our lives in the short term, to encourage Torontonians to proceed cautiously in the next few weeks, and to protect yourself. By doing so, we will be able to sustain our current circumstances and allow for more choice in where we go and what we do. If we fail to proceed cautiously, we will have fewer choices available in an effort to limit the risk of infection. Vaccines are providing hope, and with good reason. Just last week, the Toronto vaccination sites administered almost 102,000 doses of vaccine from March 15th to 21st alone. We will get through this. But at present, there are still more of us waiting for our vaccinations than have received vaccination. In British Columbia, COVID-19 outbreaks have been declared in long-term care homes, where more than 80% of residents have been vaccinated. With that in mind, I want each Torontonian to remember two important things. First, vaccines, while highly effective, do not entirely eliminate the risk of COVID-19 infection. Second, if you have been vaccinated, there remains a window of vulnerability while your body responds to the vaccine and builds the antibodies to protect you from COVID-19. The general understanding is that the body starts producing meaningful protective antibodies by about 2 weeks after vaccination and has generated substantial protective antibodies in about 4 weeks. This is a reminder that the vaccination doesn't produce instant protection, and there are many of us waiting to be vaccinated who are at risk of serious illness if infected by COVID-19. The good news from British Columbia is that the illnesses in the long-term care homes are reported to be mild, which is a positive indication. Our data in Toronto tells us that in Wave 2, people aged 70 years and over, not living in long-term care or retirement homes, made up only 7% of cases. However, this same group represented 50% of hospitalizations, 40% of ICU admissions, and 45% of deaths. So two things are important in that respect. First, it's important that those invited to book vaccination appointments do book those vaccination appointments. Access to appointments open today for those 75 and older. If you have someone close to you who is 75 or older, discuss their plans with them and help them as needed to book an appointment and to arrive at their vaccination appointment. Secondly, we all have a clear and important part to play as vaccines are delivered, more people become eligible, and the days pass between vaccination and protection. While I anticipate and am hopeful for a more relaxed summer, it's vital to remember it's still March. Summer is weeks away. Our current numbers and the exponential resurgence of COVID-19 around the world is a grave concern. Things can yet go right or go very wrong, depending on what we do while we wait. It can be difficult and confusing to remember that as we see the vaccines rolling out at high speed in the UK and in the US. In Toronto, we are delivering the vaccines we have as quickly as we possibly can. So is every other place on Earth. The demand for vaccine supply is unprecedented. The delivery of what is available is in the very, very early going. So while it is right to be optimistic about what the vaccine means for you when you get it, it's necessary to remember the benefits are only reaching a limited percentage of people right now, and that each vaccination takes time to protect the person who got it. Most importantly, the rest of us have to remember we're not vaccinated yet, and that as we take advantage of being outside in warmer weather, our protection lies in well-fitted masks and distance in every way we can create it. With that, I'll now hand it over to Brad for the question period.
Thank you, Dr. Davila. Before we go to questions, just a reminder to reporters on the line to please unmute yourself before asking your question, and we'll go to our first question, which is John Woodward from CTV News. John?
Hey there, thanks for the question. We did a story yesterday that looked at restrictions on hair salons that appear to have created a bit of an underground hair economy, more than 100 of them advertising apparently, which carries with it its own COVID transmission risk. So I wanted to know from you, what's worse, open storefront salons that are trying to follow public health rules operating, or a network of underground ones where we don't quite know exactly what's going on?
So, I don't know that there's a simple answer to the question. I will say this. We know that there is increased risk of COVID-19 transmission with interactions increasing between people. Those risks can be mitigated certainly by distance first and foremost, and through the appropriate use of infection prevention and control measures. So at this point in time, looking at what's happening around the world and noticing what is actually happening on the ground here in respect of COVID-19 transmission, I do think that it's best for us to be cautious. But obviously we are constantly working with our provincial counterparts to find ways in which we can actually increase access to services over time, but in a manner that's cautious and allows for the safe operation of these businesses, including personal services settings. We'd like to see services restored as quickly as is safely possible, but that needs to be done in a cautious manner in concert with our provincial counterparts who set the regulations.
Do you have a follow-up,
Has there
John?
been any movement on the proposal to have a outdoor hair salon?
I think that might be a question that's better directed towards my provincial counterparts, as the regulations are really for them to determine. But I would say this, we really are looking to figure out ways to allow for personal services settings and all the other services that we all miss very much to open in a manner that's safe, that's cautious, and appropriate to the circumstances for COVID-19 as we see them in our city. I would encourage caution at this point in time. We are seeing indicators that are telling us that our outbreak is growing, and we know that distance fundamentally is what makes a difference in terms of reducing transmission, particularly as we ramp up vaccination efforts, where I think we will gain more and more protection as supply increases and as we are able to get more vaccine into more arms.
Thank you. We'll go next to Dave Woodard from Global News Radio. Dave?
Thanks, Brad. Dr. Davila, there was a deputy in at this morning's Board of Health meeting who asked you essentially to see where the province was on loosening restrictions for long-term care homes. Where are you on that question, Dr. Davila, and is it something that you think should be happening sooner rather than later?
So there are a number of questions around how best to create optimal circumstances within long-term care homes. And of course, the experience of health is partially related to COVID-19 in this time and seeking to reduce COVID-19 infections, but we know that health is much more than that, and that social interaction and the ability to have a little more freedom is an important component of that. This is a subject that we have raised. I know that my colleagues here at Toronto Public Health have raised with our provincial counterparts on a number of occasions, and I understand that other local public health authorities and staff are also raising these questions. So this remains an active discussion. And again, it's a question of how do we create the right balance. As I mentioned in today's remarks, even those facilities where residents have received vaccination, as in British Columbia notably, where they have a significant proportion of residents vaccinated within long-term care homes, some of those homes are suffering outbreaks. So it is a very delicate balance that needs to be struck, and I do think that it is the subject, I know it's the subject of much conversation, and we're hoping to see some progress on that front in the days and weeks to come, hopefully sooner rather than later.
And Dr. Davila, about your comments regarding vaccinations and how they currently aren't stopping the resurgence of the virus, Does that mean that we're not really waiting for vaccinations, but something more like herd immunity to happen before we can reopen fully? And if so, then why are you still optimistic about a better summer?
Well, I am hopeful as we look at our capacity, as we see growing capacity here in the city for vaccination, and as we get more and more vaccine supply, I expect we should be able to provide more of the protection afforded by vaccine to a greater proportion of our population. I think that's fundamentally what we're looking at here. I also think that as we look at warmer weather, we have that opportunity for people to spend time outdoors where the risk of transmission is clearly much lower than it is indoors. So it's this combination of things that I think gives rise to my sense of optimism. But I am really keen to see us together as the Toronto vaccination partners and frankly, vaccination providers all throughout the province, getting access to greater supply so that we can put needles into as many arms as quickly as possible and start to really get that protection that we know is provided courtesy of the vaccines.
Thank you. We'll go next to Matt Bingley from Global TV News. Matt?
Hi there. My question is for Chief Pegg. We just keep hearing a lot about the vaccine supply, especially on the provincial side of things. And I'm just wondering if you could update us on how many are actually allocated and available in-house for the mass vaccination clinics, and whether you have enough for the 133,000 appointments that you set out for that first 4-week period?
Sure. So I'll start by saying that on this morning's Vaccine Distribution Task Force meeting, that's the series of meetings chaired by General Hillier, I would describe that conversation and the subsequent conversations as one of optimism. There was very much an enthusiasm in the midst with respect to the fact that we're seeing provincially, we're seeing more and more and more vaccine, and that is certainly great news. The allocations that have been confirmed for us is what gave rise to the original scheduling, the way that we've scheduled the clinics, and that was what permitted us to go as high as 133,000. So those appointments are live in the provincial booking system now. They are based upon confirmed allocations that have been committed to us by the province of Ontario, and I have every confidence that that vaccine will in fact arrive as scheduled and that we'll be able to continue our operations as planned.
Thank you for that. And to follow up again with you, you were talking about those missed appointments last week. Could you tell us just how many were missed? And again, just with the 75 and above now, are you confident that all of those appointments that you were trying to veer people towards this week, that those will actually be filled going forward? And if I could just tag on just one other question, I'm just wondering, when it comes to these locations, do you have an opportunity to offer one of those, 30 minutes, get here and you'll get one kind of list like some of the hospitals have been doing?
Sure. So let me start with our experience last week. So we, of course, we ran the three clinics last week. I will say, if on an aggregate basis across all three of them, we're seeing missed appointments in and around the 5% range. That there is some variance there. We've seen clinics as low as 2% and some slightly higher than that, coming out with an overall average of 5%. I wouldn't say that I'm surprised by that, and primarily based on the fact that there are a significant number now of opportunities that exist, including city-operated clinics, hospital partner-operated clinics, increased deployment through pharmacies, all of those, of course, affording people the opportunity to book their appointment and receive their vaccine in accordance with the prioritization framework. So we know that there are circumstances where people have booked an appointment and then managed to get vaccinated somewhere else and didn't cancel their appointment. We know that just life happens, and from time to time there are people that have been unable to attend their appointment. We have placed what I would describe as robust vaccine management plans in place in every clinic The clinic managers inside every one of our clinics are very closely monitoring that on a live time, hour by hour basis, and making sure that we protect all of the vaccine that has been provided to us. When doses, or when appointments are missed rather, there are a number of things that happen at the end of the day. The first is we still have a significant number of frontline healthcare workers, many of whom are operating inside our clinics, who have yet to receive their vaccine. So in the event at the end of the day there are unused doses from a vial that is already punctured, as it's referred to, so we won't open a new vial for this purpose, but if there are doses remaining that would be otherwise spoiled, we will offer those to the frontline healthcare workers who are eligible under the prioritization framework to receive their vaccine. Secondly, and what happens again on a much, I would say, a bigger scale, is we order and take delivery of our vaccine on a daily basis. So in the event that vaccine needs to be reallocated, as I commented in my remarks, we make those reallocations. So our clinic managers will adjust the amount of vaccine that they request on the next day, because in the event that we have a vial left over, we don't need to order that vial. That allows, in the back end of the system, the big logistics part of the system, if you will, to reallocate that, as one example, that vial to one of our healthcare partners so that they can administer it. So in the global enterprise view of vaccine administration, those doses are being administered. They're being administered to the people that fall within the prioritization framework as established by the province, and we're doing everything we can do to make sure that no doses are wasted.
Thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey everyone, I wanted to start first with a question for Dr. Davila and Chief Pegg. Just wondering, given the amount of outreach that the mayor mentioned to different 80-plus folks through the library and other means, whether you're concerned about the number of residents in that age category who have signed up to date at the city's clinic.
So, Jen, you're quite right. The mayor mentioned a number of outreach efforts that are being undertaken in order to reach seniors in our population, and I think these are important efforts that should continue. I think the simple answer to the question is that, as far as I'm concerned, until we are sure that everyone has been offered a vaccine and everyone who is eligible under the existing prioritization framework of the province has been, provided the opportunity and facilitated to get vaccine, and that they've either taken up their opportunity or chosen for whatever reason not to, and I'm hoping that those who choose not to take up the opportunity are relatively small, I will continue to have concerns all the way through. I think we are really committed to making sure that people, as their turn comes up, that they're aware that they're eligible, and that every opportunity is afforded to try to make it as easy as possible for them to get that vaccine. We would like to see really as many people as possible taking up vaccine as their turn comes up.
Go ahead, Chief.
If I may just add to that, I think it's important just to reiterate and to remind everyone that once any particular group, in this case, let's say, we're talking about residents over the age of 80, once any particular group becomes available and is deemed eligible under the provincial prioritization framework, they continue to be eligible. So there is no circumstance whereby that window of opportunity closes. The fact that the eligibility was expanded to include those 75 years of age or older today does not in any way remove the ability for those over the age of 80 to book their appointments. And I will say just two things that I'll point out. We certainly saw when the provincial booking system opened on March 15th, there was a very significant number of appointments booked, and then the number of appointments booked decreased continuously on a fairly steady trend line all the way down through the 21st, and of course it's jumped exponentially this morning with the launch of 75 plus. So it definitely did. It started high and then continued. There were certainly people that continued to book, but it was decreasing every day. One perhaps editorial comment, if I may. I had the chance to spend a considerable amount of time yesterday in two of our clinics. and talked to a number of our residents and a number of our seniors who had just been vaccinated. They approached me as they were leaving the clinic. And I will say that is one of the most heartwarming experiences I think I have ever had. And just the sense of relief and the sense of hope and the sense of gratitude that is being displayed and was being conveyed by those people to certainly not only to me, to our staff and to anyone that would listen, inspired me. And I hope that we can find a way collectively to share that sense of optimism and use it to encourage everyone else to sign up and get their vaccine as well. It was something I will never forget, and quite frankly makes all of the effort and all of the work that has gone in to not only put this together, but to continue to operate it, and the thousands of staff that are operating this clinic. It made every single one of those minutes worth it. So I hope everyone else can take part in that as well.
Just along that same line, a lot of people just need a little extra help or a little extra push that are of that age. And I think that there are children, there are grandchildren, there are brothers and sisters out there who can, support in one way or another, whether it's the registration process, which everybody reports to me is actually quite straightforward, the visit to the clinics itself, which again, we've had all positive response along the lines of what Chief Pegg just said. But we need people to encourage people now 75 and up to register and to go and to get vaccinated. And it's, I think, up to kids and grandkids to make that happen, to help make that happen, because there may be people who just don't know exactly how to do it or haven't heard all the news or are a little bit hesitant for one reason or another, but it's for their own good, of course, and for the good of everybody else around them, and they'll be able to see more family soon if we all can get vaccinated and get this behind us. So I really encourage people to look in on and inquire of some of the relatives and friends they have that are of that age, 75 plus, and help them to get vaccinated.
And just second question for Dr. Davila. I saw a lot of concern over the weekend, especially with the nice weather, about those working in restaurants and bars not being eligible, depending on their age, of course, to be vaccinated. Personally, I saw, streets like Ossington were already full up patio-wise. Obviously can't speak to whether those people were all in the same household, but there are definitely groups of what looked like friends together, and a lot of folks working in the restaurant industry super concerned about their own health and the health of their families.
So Jen, I think you raise some important points, some things that I was trying to get at through the remarks I've delivered today. First and foremost, we appreciate the warmer weather, long winter. I completely can see why people want to be outside enjoying the warmer weather, and that's a good thing. I think that, we have that annual sort of reemergence into the world, and there's this collective enjoyment of spring weather when it arrives. That's a regular event here in our city. Of course, it's a little bit different this year. We know that, COVID-19 is here, and as I've indicated through the remarks today, we have some reasons to be concerned. Our indicators are telling us that there is ongoing transmission and, in fact, a growing, unfortunately, outbreak here that continues in the city. I would say this, though, we know that risk of transmission in the outdoor space is certainly reduced. It's not zero. But it is, or we can't guarantee that it's zero, but certainly it is reduced relative to that which would occur in an indoor space. So distance continues to be an important component. Masking continues to be an important component. And for those who are working in industries where they may have exposure to others, certainly following all the infection prevention and control measures that are put into place become very important components as well. When it comes to vaccination of workers and people out in the community that are younger than 75, for example, that is part of the provincial prioritization framework. We are following that framework and seeking to vaccinate as many people as quickly as possible, and hopefully we will soon get to the entire population as supply becomes available. We're certainly ramping up capacity. You've heard the chief deliver his remarks in that regard, and that's not unique to us. Our hospital partners, our healthcare partners around the city are also ramping up their capacity. So my hope is that together we'll be able to quickly advance through the provincial prioritization framework, get to the entire population of the City of Toronto that's eligible. This is, as vaccine supply is available, because we'd like to see that protection afforded to as many people as possible, as quickly as possible.
Thank you. We'll go next to Mike Crawley from CBC News. Mike?
Thanks, Brad. Dr. Davila, it's actually related to Jennifer's first question there. The stats that I was given by Toronto Public Health about if you added up the percentage of people in the 80-plus group that have already had their first, at least their first shot of vaccine, plus those who have actually booked an appointment, it's only about 60% of the population. I'm wondering what percentage you want to see vaccinated, or what's the target that you need to be hitting for it to be effective? And what do you think are some of the reasons why people aren't quite so enthusiastic to book their vaccination appointments?
Mike, I think a couple of things. So let's start with the last part of your question. I'm not sure that we can say that it's lack of enthusiasm. I think it's premature to say that. I think it's quite impressive that we have gotten to the point where we're at. Vaccine delivery here is still very much in the early going, as I just mentioned in my remarks, I guess I should say. So we are seeing more and more pickup. The numbers you indicated are, prior to today, every day that number continues to grow. And as the chief rightfully pointed out, that once you're eligible, you will continue to be eligible. So we do know that there are ongoing opportunities for our seniors, particularly those 80-plus years of age, to continue to get vaccine. Some of our seniors in our community are not able to get out to, a mass immunization clinic, particularly those who are homebound. And there are processes that are available for those who are established clients of home-based services, so that we're getting vaccine to those individuals in partnership with our healthcare partners. So that's, another component of our older population that is still being addressed. And I expect we'll continue to see more and more of that population getting covered. And I do think that there is as well some encouragement for people to seek out vaccine that's provided when they see more and more people around them actually receiving vaccine and responding well to vaccine. That certainly was the experience in the early days that we saw within long-term care homes and with long-term care and retirement home staff and residents. So I expect that we'll see similar things in the broader community as well. With respect to herd immunity, or the level of coverage that you're speaking of, obviously, as a public health practitioner and knowing what I know about the effectiveness of these vaccines, the higher we can get that coverage rate, the better it is for all of us, right? That provides protection for the individual receiving the vaccine and hopefully protection for the entire community. But certainly the science indicates that, we're looking at something around at least 70%, but of course the higher the coverage rate we can get, the better the protection that's afforded by the vaccine.
And if I could ask you about the situation with the pharmacy sort of deserts in the northwest and northeast of the city. I know that this was, as you mentioned, done largely through the province. How satisfied are you with the explanations that you've been given about the relatively low number of pharmacies that are participating in those areas of the city? And what do you think that this actually demonstrates? Like, what's behind that low level of participation from the pharmacies in those neighborhoods?
Mike, not having been involved in that, in those initial discussions, anything I would say about how decisions were made, at the outset of the pharmacy pilot would be pure conjecture. I would say this, though, once it became clear to us at Toronto Public Health which pharmacy locations in the city were participating in the pilot, We looked very carefully at those areas of the city that would benefit from having more of a presence of that pharmacy pilot in place, given the risk of transmission and the impact of COVID-19 on those communities, and as well thinking about which pharmacies have successfully participated in vaccine administration, particularly the flu campaign in previous years. So we looked at all the data that were available and made some suggestions to our provincial counterparts to discuss as they seek to expand that pharmacy pilot. And it's our sincere hope that our suggestions will be taken seriously and perhaps even acted upon as those pharmacy pilots and the pharmacy channel is expanded by our provincial partners in concert with the pharmacy providers as well.
Thank you. We'll go next to Shauna Hunt from City News. Shauna?
Oh, hi there. This first question is for Dr. Davila. Today at the Board of Health meeting, you did say that, Toronto is seeing a resurgence of the virus. Toronto feels pretty open right now. I don't know the last time you've been to a mall, but the ones that I've checked out, they've been really busy. Lots of lineups, lots of people inside. Lots of groups of people together. The medium-sized retailers too, big long lineups all day long, oftentimes wrapped around buildings. And now we're adding the outdoor dining into that, where people are gathering. It was really busy on many patios this weekend. And I guess it's hard to know if they're all from the same family. And in those scenarios, people aren't wearing their masks because they're eating and drinking. I guess I just want to know if with the resurgence of the virus that we're seeing and the variants at play and how easily they spread, is it time to scale back, or when is it time to scale back?
So when it comes to transmission of COVID-19, there's no question. I've mentioned both at the Board of Health meeting this morning and this afternoon in my remarks that there is clear evidence of a resurgence of activity in COVID-19. And this is unfortunate. It's exactly what we don't want to see. I think it's important, though, to recognize that we know, even with variants of concern, there are some very important steps for self-protection that we know work. And fundamentally, the first of those is distance. So to the extent that we can create distance between ourselves and those with whom we don't live, that is our first and foremost protection at this point in time. So that's something that I have been emphasizing through these remarks and through every opportunity that I have to speak with the residents of Toronto, that distance, distance, and distance continues to be an important component of self-protection. And where distance, for whatever reason, cannot be maintained in order to do essential activities that require, being outside of your home, that use of a well-fitting mask as much as possible is another component of self-protection, and an important one at that. So, I appreciate that people, I talked in an earlier answer about how we are all emerging from a long, difficult winter. And, we've had nice weather over the last couple of days. I do think it's important that people have that opportunity to appreciate the warmer weather, to get outside. It's good for mental and physical health, to enjoy warmer weather and to get some physical activity outside. But that doesn't take away from the fact that distance continues to be an important measure, a self-protection measure that we can all take. The next measure, of course, is that as our turn comes up for the receipt of vaccine, that's the next tool that we have available in our toolkit to help provide all of us with protection against COVID-19. So I think it's these elements taken together. And fundamentally, when it comes down to what the regulations will be, what restrictions will be in place, these are decisions that actually rest with our provincial counterparts. I can offer advice. I can certainly offer the very important on-the-ground local perspective, what we're seeing here in Toronto. But at the end of the day, regulations and what restrictions are put into place are the purview of our provincial counterparts. What is in our control, what's in our hands, is how we choose to behave and the choices that we make. And I know that if we make the right choices, as we have done before, that we'll put ourselves in better stead as a city towards getting back to life more like it was before there was such a thing as COVID-19.
Okay, I guess my next question
Shauna,
is,
just
The mayor's
just
just
before,
gonna
I'd
jump.
just like to follow up on the last point Dr. Davila made. You know, it's interesting, just barely more than a week ago, we were sitting here and there were questions being asked about whether Toronto was too shut down, the most shut down city in North America, and we're here barely a week later and we're talking now about whether the city is too open. And I think all this illustrates is that we're having, as we've said, continuous discussions between and among ourselves and with the province. I can tell you, I, for one, would not think of going against, you know, after a lot of questioning and discussion, the medical advice that we're getting as to what is best. And in the circumstances, it is up to people to decide if these very small additional liberties that were given in the last couple of weeks to allow retail to be open a little bit and to allow outdoor dining is something they want to see continued. I mean, the lineups in a way are a good news story because it means that people are being kept out of the stores, but if people responsibly behave in the lineups and space themselves out and wear their masks, then the lineup need not be necessarily a source of concern. And the same is true of the outdoor dining. I mean, let's be honest, it's not going to be realistic for us to be sort of checking every driver's license and interrogating people, nor would anybody want to, with respect to whether they live together. But people should just decide if they want to help themselves and their own health, if they want to help the businesses that they want to patronize, and get back to a normal life by the summer, as we've been discussing, then it would be best if they followed the rules and only went to an outdoor patio with somebody they live with. So it is really in people's hands themselves as to whether these small additional liberties that have been given, which go not as far as many others would advocate, but nonetheless are based on medical advice that I believe is sound, that they can make that work. And I think people can if they decide that that's what they're going to do.
okay, sounds good. I just, my quick follow-up is there any new data showing where the spread is happening in Toronto? Is it, you know, mainly happening in the workplaces or schools or daycares, or is it still people visiting with friends and family? Just what's the latest on the spread?
So at a very high level, it's going to be all those places where people actually are in close contact with each other. And in some cases, you're quite right. There are workplaces, and you'll have seen that we do report on workplace outbreaks and seek to improve conditions within those workplaces. But fundamentally, we are talking about a disease that spreads from person to person when they are in close contact with each other. And close contact with the respiratory droplets that come when people talk or breathe or cough. This is how it moves from one person to the next. Hence, you can imagine that what we see in our data is a reflection of cases that occur where people are actually interacting with each other.
Okay, final question is to Beatrice Vyman from CP24. Beatrice?
Good afternoon. My question is for Chief Pegg. Chief, I've been sitting outside in the parking lot here at the Toronto Congress Centre all morning long. The line right now longer than it has been at any point today. I'm literally watching staff and security handing out foldable chairs right now to people in line. Although all the seniors that I've been talking to tell me that the line outside is the least of their concerns. It's once they actually make it through the front door, they're now sneaking through another line about half an hour long to make it into the chair to get their vaccine. That's no problem. Then they wait 15 minutes, again, no problem. And then it's at least 30 to 45 minutes to check out and make their way out the door. This entire process taking them upwards of 2 hours. One senior, 2 hours and 10 minutes. Is this something in your mind that's acceptable? And if not, what's going to be done to make sure that these seniors aren't standing on their feet for upwards of 2 hours to get their vaccine?
Yeah, thanks very much, Beatrice. And I am in direct and regular contact with all of our teams and certainly the clinic managers that are on site there. And I'm aware of the lineups today. And, you know, first and foremost, no, what you're describing is not acceptable to any of us. We experienced a couple of challenges there today. We had some unplanned absence on the part of staff, some of the clinical staff that are required to operate the clinic. So we are doing our best to manage in response to that. So some additional staff being called in. I think first and foremost, there's nothing more important to us, obviously, than health and safety, the safety of the client. But second only, I would say second perhaps only to the health and safety, The client experience, the experience of our residents that are moving through our clinics is very important to me, and it's very important to all of us. And I can assure you, we are, and our team is continuing to do our very best to find the balance between what I would describe as the vaccine expediency. So, you know, administering, making sure that we're scheduling as much as we can do, so we're putting as many needles in as many arms as we can in a day, but finding the balance between that expediency and that client experience. And what you describe for me now isn't what we're looking for. That's certainly not our goal, something that we will follow up on. And quite frankly, if we don't have this right, we'll adjust and we'll move forward. So I would just say to anyone that's been there today and anyone that's experiencing that, I apologize for that. Please understand that it's not something we take lightly. I actually have follow-up meetings set up on this with our clinic management team that will happen shortly after this press conference, and we will continue. We are hard at work right now doing our best to manage that circumstance. We'll continue to be hard at work, and we'll get it right.
And I appreciate that this is just day one of, you know, tripling the amount of seniors that you're having in here, Chief. But just to follow up on that, what is, I guess, the target? What's the kind of the sweet spot that you're looking for that client experience from the moment they get in line, and it should only be, you know, 15 minutes before their appointment to when they're out? What's that perfect sweet spot? I imagine it's certainly not 2 hours and 10 minutes.
No, it certainly is not 2 hours and 10 minutes. Based on the model that we put in place, our target is somewhere in, I would say, on average in the 30-minute range. It is important to note in the aftercare component, so when you move through the process, once someone is inside the clinic, they have to go through a process of screening. Then they have to go through the check-in where they're checked in on the COVAX system, and then get in front of, actually sit in front, sit with a vaccinator, get immunized, and then they move into the aftercare. That aftercare is an important part. That is where we have trained first responders and healthcare professionals that are monitoring each person to make sure that they're not suffering any ill effects, that they're not feeling ill, that type of thing. When we're dealing with any client group, but certainly when we're dealing with folks that are senior, that are in this case 75 years of age and older, it is not uncommon for people to require additional extra time in the aftercare. And sometimes that's significantly additional time in aftercare. So those are things that we're learning as we go. This, of course, to be very candid, is an entirely new process. We are, you know, we've applied all of our best knowledge that our colleagues at Toronto Public Health have been able to afford us in previous clinics, but very much being managed and learned and evaluated on an ongoing basis, and everything that is being experienced today will automatically be fed back in, and we will, whatever we can do to enhance the client experience and enhance the process and get that back into that somewhere around a half an hour per client. That's what we're looking for, and at the end of the day, my number one goal, I want people to come, their entire experience to be safe, and I want them to go out the door with a smile on their face knowing that they just received a very important vaccination and that their experience in receiving that was good. So we're hard at work, and my team won't stop. None of us will stop until we've done our very best to get that right.
Thank you very much, Chief. Thank you for joining us. That concludes today's briefing. Our next scheduled briefing is this Wednesday, March 24th. Please note the time is at 10 a.m. 10 a.m. start this Wednesday. Be well, everybody. Thank you.